Now we'll talk about how we are able to determine if somebody has weak bones. All right, and this is a measurement of bone mass to be able to determine if a person has weak bones. So I'm mainly trying to talk about how the whole measurement is done and all. So measurement of bone mass to determine weak bones is as follows. All right, so this is when your bones are healthy, and this is when your bones, the density is kind of like, getting away and becoming weak. So different methods include things. You have the this is dual energy X-ray, absorptiometry. We also have the quantitative computed tomography. We have the ultrasound, quantitative ultrasound. We have the peripheral bone density tests. So let's look at them. The dual energy X-ray is the most common and the most sought after. So it uses low dose X-rays to now measure bone density. So measurements are as follows. They now classify them under T-score. So if it is -1 or higher, say it's normal. If it's getting from -1 to -2.5, it's low. Osteoporosis, that's when you say that everything is weak. Therefore, quantitative computed tomography uses CT scans to measure the bone density and usually construct it in a 3D image, so you can now be able to now clearly see how the bone is actually weak. Ultrasound is often done at the heel bone. Peripheral bone tears is when small machines will measure densities in all those wrists, fingers, heel. Those ones like the bones that are on the limbs, at the end of the limbs mostly. Alright, so supportive tests, you can also do all those blood tests to look at the levels of calcium, vitamin D, hormonal levels, also bone turnover markers. So why it matters is it actually help you to dictate low bone mass very early, and it will help you to initiate treatment. So this treatment will now prevent how will I put it, all those fractures from coming in later. So it also helps you to monitor bone density. So as you are treating a particular patient, you are monitoring to see how the patient is responding to treatment.